Yeah.
Hi, Dr. Kiran Kumar.
Hello.
Welcome to the metakinology of semaglutide.
Thank you.
So, right now, semaglutide is available as off patent, and when we talk about the social media buzz and everything, created a lot of doubt in clinicians' mind as well as in patients' mind. So, I just want to know what are the current misconceptions are there with regard to semaglutide, and how you tackle that, or what are your take on the common misconceptions surrounding semaglutide?
See, this is one question which we have to address that, and this should be circulated well in all the social media. Why? Because the misconceptions are more brought by these social media influencers. The first misconception about the semaglutide. So, people consider this as a obesity medicine, but this semaglutide was introduced as a diabetes medicine. So, as a side effect, weight was patients were losing weight. So, instead of promoting it as a weight loss medication, so one should consider it as a diabetes medication with some weight loss. Why? Because it not only reduces the weight, it improves HbA1c levels, it improves fasting sugars, it improves postprandial sugars. So, it has a good impact on the glycemic control. The second misconception is, so whenever you achieve good HbA1c, so can I stop this medicine? So, that is not the thing what a patient should think. So, once his HbA1c is reduced to the normal levels, so maybe we can reduce the dose of semaglutide, or we should continue semaglutide and we can taper down or stop the other medicines instead of semaglutide. So, that is how you have to take this medicine as a long term medication, not as a short term medication. And the other misconception is, so once you take semaglutide, patients experience severe side effects. This is one most common misconception, because of which patients are not considering semaglutide as an important treatment for diabetes or obesity. So, why? Only some 60 to 70% of the patients experience side effects with this semaglutide, and those side effects also are not severe, mild side effects. So, how to minimize these side effects? So, we can start with the slow dose and we can gradually escalate the semaglutide. So, and then we will not see the side effects as people discuss around in the social media.
Very true, as you highlighted with regards to diabetes, that it should be taken for long term. I think similar concept may exist for obesity as well, that we must continue this drug for lifelong, considering the obesity as a chronic therapy. So, what your take on that?
See, this is another good question, where people consider that this should be taken lifelong for obesity like that. So, that is also not right, but because whatever the trials we see, so once the medicine is stopped, patient is not going to get all the weight back. Okay, so patient will lose some weight, and there will be effective weight loss of around some 30 to 40% of weight loss, even if patient stops taking the medicine. But you can ask, there is weight gain, 50 to 60% of weight gain is there, but this weight gain happens only when patient does not follow the lifestyle changes whatever he has acquired when he was taking the semaglutide. For example, we advise patient to take high protein and follow good lifestyle changes, do good exercises and muscle strengthening exercises. So, patient should continue all these things once he stops medicine. So, if he does not follow all these lifestyle changes, then again obviously he is going to get the weight back. So, whenever you are starting semaglutide, you have to focus more on the lifestyle changes, good protein intake, and once the medicine is stopped after the desired amount of weight loss, so patient have to increase the exercise time and strictly follow the diet patterns. So, then there is no requirement of the semaglutide taking for lifelong.
So, very valid point that beside medication, we must follow the lifestyle advice throughout the life. Then the requirement of medicine can be reduced or maybe stopped if patient is following it very rigorously. Otherwise, we can reduce the dose and we can maintain the weight loss. So, that can be one of the options. Thank you, Dr. Kiran Kumar, for providing valuable clinical insight.
Yeah, thank you.